So, treatments for arthritis. Diet and lifestyle changes. Obviously, good for overall health, good nutrition, high impact activities. Once you carry a diagnosis of osteoarthritis, high impact activities like running and jumping and things like that, you probably ought to not do. Excessive weight places excessive pressure on the joints. There is a lot of controversy, and there has been, for those of you who have had problems with your joints for years. Some people's first approach is, oh, you got to lose weight. You got to lose weight. Well, if your joints hurt, you can't exercise, you're probably not going to lose weight. That being said, there is absolutely no question that people who are overweight are going to have more problems with their joints. The easiest way to consider that is a simple home activity, not so much in Florida, but up north, going up and down stairs. For those of us who are from up north and used to live in houses with basements and attics, and usually the laundry was in the basement, so you're up and down and up and down and up and down. Up and down the stairs, the strain across your knee joint is roughly 8 to 10 times body weight. Okay? Everybody's cartilage is the same. If you weigh more, it doesn't make your cartilage stronger. So you can just kind of use that as a good reason as to why this is an issue. Okay, exercise. Yes, to answer your question, exercise, high impact exercise, when you don't have normal cushion on your bone, is going to be detrimental and probably not going to be possible. But lack of exercise is going to take that arthritic joint and it's going to make it a lot stiffer. If you weaken the muscles aren't going to be able to support the joints as well. And maintaining the mobility of a joint and maintaining the strength of the muscles around the joint is extremely important in the face of arthritis. And the number one question you get a lot of times, or I get a lot of times, you give somebody a diagnosis of, well, I guess I should stop walking. I guess I should stop doing this. I guess I should stop doing that. I can almost guarantee, and there's very few things in medicine that I can guarantee, I can almost guarantee that somebody with arthritis, if they stop moving, they will get worse. That's a virtual guarantee. So exercise in general is good. Certain types of high impact, and I don't encourage people with newly diagnosed hip or knee arthritis to go take up triathlons or marathon running. I mean, that's just not going to happen. But regular walking, biking, swimming, biking and swimming are great, but you do have to include some type of weight-bearing activity, and walking is fine. It doesn't have to be the pounding of running and jumping. Treatments for arthritis, obviously medications. The number one medication for arthritis, Advil, Aleve, aspirin, anti-inflammatory medications. There are non-steroidal anti-inflammatory medications, the over-the-counter ibuprofen, naproxen, which is Aleve, and then prescription ones. Aleve is over-the-counter, it's naproxen. So ibuprofen is Advil or Motrin or whatnot. Aleve is naproxen or naproxen sodium. None of these are any better than any of the other ones. There is a multitude of them out there because every one of them works for somebody. They may not all work for you. I'm an Advil guy. I get a headache, I get a sore back, I get my knee or shoulder act up. Ibuprofen does wonders for me. It may not for you. There's no reason for that. It just is, okay? So for those of you who have been prescribed various medications, you've probably found some don't work. Others do. Others work sometimes. They don't work all the time. That's why there's a bunch of them out there. Don't be afraid to change, okay? That's why they're there. I tell everybody it's a trial and error. Search till you find, okay? And hopefully you'll get lucky and find one that works for you. If you do, stick with it until it stops working. The biggest problem with these, the number one side effect with all of them outside of the Vioxx Celebrex cardiac thing, is stomach problems, stomach upset. So very important that you take them with food, something in your stomach. If you do develop stomach upset because of it, stop. People with real bad arthritis and they don't have other alternatives and they're not surgical candidates, you can be placed on agents to protect your stomach, which would allow you to take anti-inflammatory medications. But I'm not a big polypharmacy guy. I don't like to give you a drug that you can take another drug. It doesn't make a whole lot of sense to me, but occasionally that's the only option. There are also a couple of newer anti-inflammatory medications that are combined with stomach protective agents, and they tend to be a little bit more well tolerated. Cortisone injections. It's an alternative that we have in our armamentarium. Cortisone injections, again, you remember that old slide, manage, treat, no cure. Cortisone injections cure nothing. They change nothing. They're just a different way to do this, okay? It is a way to settle down some of the inflammation that's causing the acute pain and occasionally settle down some of the swelling and decrease some of the irritation in the lining tissue of the joint to make you feel better. That's why they don't last forever. That's why sometimes they don't work. They don't change anything. It's just a different way to approach trying to help the pain. Upsides, downsides. Upsides of it, it's a lot quicker than taking a bunch of pills. There's fewer side effects than taking a bunch of pills outside of people who are diabetic. When you're diabetic, if you're a labile diabetic, which basically means you have trouble controlling it anyway, cortisone can shoot up your blood sugars. So anybody who's a diabetic, if you get a cortisone injection, you got to keep an eye on that. If you start to feel funny, there's a good chance it's because your blood sugar is going through the roof. And if you're on pills or insulin, then you probably need some more. Other downside of cortisone injections, more is not better, okay? If they work for you and they last a while, that's great. You've won for now. But if they don't work or they're very short term, you get a cortisone injection, you feel great for a couple days, and within 2 weeks you're right back where you started. Maybe if it's the first time around, a second one might help a little bit more. But in general, if you're not getting at least 3 to 6 months relief from a single injection, more is not better. Over time, cortisone can cause destruction in the joint that will add to the arthritic problem, okay? So they're a great tool, but they're not a solution. Celebrex, good medication if you have stomach problems and no history of previous heart surgery. That now would include catheterization for stent placement. So if you got a bad heart and you've had any intervention, you don't want to take this. For everybody else, it's still available. They did not take it off the market, even though they kicked Vioxx to the curb really fast. They are very similar medications. The same potential is there. The same potential was there from day one. But in today's day and age, something causes something bad, you have to pay a lot of money, and it goes away. I don't want to use a cane. Makes me look silly, makes me look old. I'm too vain. All right? Permanent or short term, it's there for a reason. Tell everybody you just fell off your roof. You know, make up a story. But canes are extremely helpful in offloading the joints in the lower extremities. And if it's a temporary flare-up and you need it, there's nothing wrong with it. Get a fancy one that's a showpiece if you want. Use an umbrella on rainy days. And I don't say that to be too lighthearted, but I can't tell you how many people I've suggested using a cane to, and they just outright refuse. They don't want to hear it. I can't do that. I can't go out into public like that. Well, you know, then you're going to have to deal with the pain.